Welcome back, everybody, to our nutrition element module here. So now we're on to looking at weight management. So we need to remember that for our weight loss strategies to be effective, we need to make sure that we're providing long-term strategies that are going to be sustainable and create that steady state of energy deficit, but still allow our clients to continue to function on a day-to-day basis. So I think I've mentioned this before, our energy balance equation. Really simple one to remember and to base our programs on is that if there's more energy in than energy out, there's going to result in weight gain. If there's less energy in than energy out, it's going to be weight loss. And if energy in and out is equal, we're going to get weight maintenance. So in order to achieve weight loss, we want to create an energy deficit. So there are a number of different ways that we can do this. It can be done just by a diet or by exercise alone, or most effectively, it's going to be a combination of them both. So if you think about just the diet side of things, in order to create that energy deficit, we're going to need to create a mild calorie deficit. And that's usually somewhere between, well, really 200 to 500 calories a day. And quite often this can just be achieved by looking at what they're already eating and modifying their existing diet rather than creating anything too severe that they're unlikely to be able to sustain. But even with a calorie deficit of about 200 kilocalories a day, that's going to give a weekly deficit of almost 1,500 kilocalories, which would end up being half a kilogram. So a lot can be achieved with relatively small changes, but just needs to be sustained over a long period of time. This energy out idea, we've looked at diet, but actually another way to obviously create a greater energy out is by increasing activity levels. And a simple way to do this is just looking actually at the activities of daily living, the kind of things that we're doing all day, every day, and seeing how you can increase those ADL activities for your clients. And ideally, that needs to include cardiovascular exercise in order to burn those excessive calories. Resistance training is really effective in weight loss as well because it creates greater amounts of lean muscle tissue, and muscle tissue burns more calories at rest than fat does. So if you have a greater proportion of muscle, your metabolic rate will be higher even at rest. So ideas of activities for daily living are things like taking the stairs instead of lifts, trying to swap the car for walking or for getting on your bike, for just trying to increase your step count, whether that's getting off the bus earlier or going for a walk at lunchtime or around the park early in the morning, or taking up a class like dancing or Zumba, but just generally increasing activity, and walking is often the easiest way of achieving that. Just going back to activities for daily living, other ideas can include things like doing squats when you're doing your teeth, or going up and increasing the number of times you go up and down the stairs. So it's really thinking of clever little ways of just doing these kind of micro exercises during the day for your client, advising where they could do that. Little press ups in the kitchen, against the work surface, anything that increases their activity. So looking specifically at cardiovascular activity. So cardiovascular activity is really efficient at fat burning. And so in order for this to be enhanced, the cardiovascular system depends on a supply of oxygen to be able to burn fat. And the amount of muscle tissue needs to be improved to increase your work capacity so that higher intensities can be sustained for a longer period of time. So we want to make our muscles more efficient at using oxygen so they can burn fat more efficiently. And as fitness levels improve, it's really important to include activities at a higher level of intensity. So there are some physiological and anatomical changes that need to occur for fat burning to happen effectively. So that was cardiovascular activity. Now, resistance training increases, obviously, the more resistance training you do, the more muscle you build. And that increases the amount of energy that you are using up at rest, your BMR, your basal metabolic rate, which we'll go through in another presentation. However, if there are complications such as high blood pressure or type 2 diabetes before you start on a resistance training program, it's always good to obtain the consent of the GP. You have to look at every single client individually. That's why you're a personal fitness trainer, because you need to look at their particular fitness levels and do a graduated progression of fitness, be that cardiovascular or resistance training, as their skill and their fitness level improves. So it's good to know look at different kinds of activities and see what the energy expenditure is. And if you have a quick scan down this chart, you'll see quite quickly that actually it's cycling in this particular list burns the highest amount of calories per minute. So race cycling is the highest, followed by indoor stationary cycling, but you have to notice the intensity. That's at high intensity. Once you drop down to a low or moderate intensity, you're looking sort of at half the amount of race cycling. Running provides 10.5 kilocalories per minute. So running, jogging, walking ends up providing the same as moderate intensity cycling, but all of them will be better than doing nothing. Weightlifting, you'll see, it's a relatively low amount of kilocalories per minute, but as we said, what it does do, builds muscle, which will burn more calories at rest. So it all balances out, really. So thinking about overall the guidelines for effective weight management, you need to make gradual changes to a client's eating plan and their overall lifestyle and energy levels, if you're going to have any lasting impact. So it's just being patient, taking time, seeing the bigger picture. Always ensure that your client's eating a well-balanced diet with a variety of foods and that you stick to the healthy eating guidelines. Ensure they don't go hungry or they're skipping meals, because that's when the danger zone is that you just go and snack on really high calorie, high GI foods. Being prepared for some setbacks and barriers, for social events, for times when things just slip a little bit, and just being ready to get back on the wagon and just to reset again. Getting active and keeping a food diary is really helpful, so you can track for your client where things are going well and where things aren't going quite so well. Setting realistic goals. Now, a good guideline is about 0.5 kilogram of fat loss per week, and that equates to a calorie deficit of about 3,500 calories per week, or 500 calories a day. So that's just over a pound a week that you'd be losing. So aiming to achieve, a good amount to achieve would be a 500 kilocalorie deficit, but you can aim for a lower one, which will just take a little bit more time. So you want to decrease the food and you want to increase activity. So even by decreasing food by, say, half of that, then if you're increasing output, then that could come up to 500 kilocalories a day. Never consume fewer than BMR, as that affects the way that the body works and processes its food. Eat little and often, choosing things that have low GI scores rather than the high GI, because you want that low and slow release of energy. Choosing high fiber helps to make you feel full for longer. Effectively monitoring progress. And as always, increasing activity and exercise at a graded rate that's going to be suitable for your particular client. So those are just some guidelines on weight loss and looking at some general pointers as to how you can plan out a program for your client.